Hello friends, I'm Dr. Gajanan Dhanipkar. I'm practicing in a suburb of Mumbai for last 24 years or so. And in last 24-25 years of my practice, something that I've always loved treating was acute emergencies, fevers and pathological conditions. And this is exactly what I want to share with you today, how to manage a case of fever, maybe a viral or an infectious fever. I'm not going to speak to you something new which you already don't know. What I'm going to share with you today is a clinical approach. How do you see a patient? Our materia medica is rich with symptoms of most of the remedies that we use in fever. But the main problem that arises for a young homeopath, especially when he's treating acute emergencies like fevers and many others, is what is that he should rely on so that his prescription is just perfect and the patient experiences relief. Of this whole maze of symptoms, what is that we need to choose? We all know that this is an art. But the main question I always had is when will this become a science when 10 homeopaths looking at one case will come to a same remedy? This is what happens in most of the clinicians where they are very sure about their prescription in especially acute conditions. What makes them sure? What is that thing that they observe? What is that skill? How a patient presents to you clinically? What is that you need to see? What is something that you need to search in a case? And what is that case taking in an acute condition, especially fever, that we as physicians should know will help us to come to a remedy? When you're dealing with acute emergencies like fever, the situation itself is so overwhelming that we do not have the time for the exact conventional case taking that we do. That doesn't mean that we don't have to do the conventional case taking. Of course, yes, we need to do that conventional case taking too. But that acute observation and picking up the right symptom will actually see through the case with a good result. Second thing is, when you're treating, we also should know the sphere of action of the remedy so that when you're prescribing, we know that this patient is going to be completely cured, or is there some residual symptoms that may be left down? Because in an acute condition, it is a progressive state where the patient may deteriorate, and we need to know the prognosis of the case. If you know your remedies well, if you know them with their sphere of action, the peculiarities and characteristics so very well, the way they present in a clinic, I think you will never miss a case. That is what today I'm going to share with you all in this episode of Managing Fevers. This is what I told you about treating fevers. But now, if it's an epidemic where you require quick prescribing in many cases of similar symptoms, so do we have a different approach in case taking? Actually speaking, no. We need to do the same approach and prescribe by finding the characteristics, peculiars, and individualistic symptoms. But once you see many patients of the similar illness, you will see that it is the same remedy that is coming again and again. And this same remedy, which comes again and again, is generally the remedy that you need to prescribe every time. But if you see, there was one of the epidemics which our Sir Dr. Hahnemann managed. It was a case, the epidemic of scarlet fever, and he had prescribed belladonna. But in his lesser writings, he gives that he had prescribed belladonna, But in one odd case or other few cases where the patient came up with some residual symptoms like some rash or an abdominal pain, he had to give chamomilla to complete the cure. What this means is that though we have a kind of a approach which is generalized, but the cure can be still not complete if a residual state remains. So it is very important as a physician to be open minded even when you're prescribing a remedy like a genus epidemicus. Now, how to approach a case of viral fever, which is very much a commonest complaint that we are going to see in our practice. Before we go to the homeopathic part, it is very important that we know the disease part as such, though we are not going to discuss much in detail. But the patients generally come to us in viral fever in majorly three different stages. The initial stage, generally we all know about it, is where the patient will come, he's slightly feeling feverish, flowing nose, watering of eyes, listless, weakness, slight irritation in the throat. This is the prodrome phase, where the early phase, where the patient has just begun to get into a feverish feeling and maybe even the temperature is not developed. The patient many a times comes and tells us, "Sir, I feel feverish, but there is no temperature, but I don't feel like working. I just feel like lying down, the whole body is aching." This is the very initial stage of fever. Then, after maybe in some cases it progresses very fast, that depends so much on the individual constitution. And in some cases, it takes maybe 12 to 24 to 48 hours for the next stage to come, where the patient will actually come to us with fever, with chills, headache, body pain, and listlessness, lethargy. The headache will be not very severe, but it will not make him work. This is the second stage. There may be even cough, which is slightly more than just an irritation. This is the second stage of a viral fever. Some patients present to us directly in the second stage. In some cases, you directly see the patient in the next stage where the headache becomes very severe. Patient is extremely prostrated, dull, not able to wake up. The lung involvement has started, a disease which progressed from the nose, the throat has gone into the lungs, a picture of pneumonia is seen. Patient is continuously coughing, becomes breathless. Many times they present with vomiting, diarrhea. And there are some cases where they have listed going into convulsions and delirium and loss of orientation. This is the third stage in which the patient may be seen. What we actually need to do is to ascertain which stage the patient is, because we have remedies to act in each stages. And we have to know the sphere of action of the remedies if in case we need to follow it till the last stage if the patient is in progressive condition. This is the most important aspect of understanding a viral fever. Now comes the most important aspect for a clinician, the approach in viral fevers. My friends, the key to success for a homeopathic prescription, which I personally believe is your art of observation. If your observation is acute, then there are very less chances of failures. Now, what is to observe in a case? This is something which is very, very important now. As the patient comes and enters in your clinic, you need to first, before even asking a question, observe how is he. Is he an active person, dull, morose, sleepy, drowsy? What exactly is his demeanor? How is he? This is a very important aspect because the remedies generally are expressing their state in the way they present. Once you write down the exact picture that he's giving to you, then watch for, before even asking the questions, Watch for any signs, any redness of a particular part, any coryza, any sneezing, okay, if he is sweating anywhere. These are those physical symptoms which will actually help you to nail the remedy. And then, as your case staging progresses, you need to ask about how the problem started. In some viral fevers, the condition progresses very rapidly, and in some cases, it takes time. So, we have different remedies where the progress has happened very fast, and different remedies for the cases where the progress has been dull, slow. Then, what is the order of involvement of the organs? Is the problem started with a flowing nose, with a throat pain, with the exposure, or had it any peculiar cause, or was it a regular pattern that he always has it, or was it an improperly case that was treated incompletely before? So this pattern also becomes very important. Before going to its peculiars, please try and understand his more important generals. For example, how the fever started, the pattern of the fever. Were there stages that followed each other, or directly the stage of chills and the heat surpassed and it was directly in the sweat stage? Which stage was predominant? And is there any peculiar concomitant that is there in the stage of fever? The concomitants form a very important role in your prescribing. How is his thirst? How is his craving for food? How is his tongue? I'll tell you, it is very important to note the tongue of the case because every tongue has some distinct relation to the remedy. And if you have an acute observation of the tongue, there is very less chance that you're going to miss the remedy. Is he having a peculiar craving at that particular time? Any particular modalities which help the patient in general? So when you get a general idea, you will feel or you will come to know that what are the likely remedies that the patient may be into. Once this stage in case taking is over, then you can go on to the peculiarities in the case, which is generally the individualizing factor. So it can be the behavior, it can be his nature, it can be the dreams, delusions, or for that matter the delirium, something that will individualize the case. And I always believe, however good that we have come to any generals, for a homeopathic physician, for the remedy to act better, it is very important that you individualize before you prescribe. However, you feel the remedy is covering everything, if the patient is individualized, I'll tell you from my experience, the results have been excellent. So that is in short how to approach a case, and I guess we all must be doing the same way. But most important is the way you see the patient clinically. Now, I just told you about how to approach a case. Now, I would like to share with you some of the frequently used remedies in viral fevers and their clinical presentations. See, as I told you earlier, these remedies have been extensively described in Materia Medica. We all know them. And what I'm going to share with you is not the Materia Medica, not the repertory, but what we see clinically that is verified again and again, which has helped to give consistent results. That's the thing that I'm sharing with you. How the patient is seen, how you can individualize the patient with minimal information. Because, mind you, I'm speaking about arsenic in an acute condition. Otherwise, we have huge collection of symptoms for arsenic. How will the arsenic patient present to you? See, arsenic is one remedy that is indicated in all stages of fever. Let it be an initial stage where the patient has coryza and throat pain and irritation in the throat, or in the middle stage where the patient has fever and body pain and myalgia, and in the last stage where the patient has the affection of the lungs, where the lungs are involved, congested, and patient is extremely prostrated. So we may find this remedy in all stages of viral fever. The way the patient walks in generally in an acute condition will be a patient who is more anxious and restless. He will have flowing nose, watering of eyes, fluent coryza. He will tell you about burning pains, mostly in the stomach. And arsenic has a very peculiar thirst for cold water. No doubt he's chilly, but still he wants cold water. Then another peculiar thing which we have confirmed again and again, and which generally surfaces many a times in all conditions of an arsenic case, if it is pains or if it is burning, it has to be better by warmth. This itself is a key to open a case of arsenic. And we all know about the fastidiousness of arsenic, the anxiety of arsenic. This is something that will help you to confirm the remedy. Later in the stage, when the patient comes to you in a second stage, there the fever may be quite high. And during the fever, the patient has a thirst for sips of water. This is very peculiar about arsenic. This is still at a stage where the weakness has not set in. He may feel weak, he may lie down, he may be anxious. In this stage also many a times he resorts to his fastidiousness. But the heat stage in arsenic fever is generally long. The heat stage predominates. So many a times you will have patient coming with lot of burning and heat. There will be very less episodes where the patient's fever has gone down or the chill is predominant. The heat stage predominates, and this is another peculiarity of arsenic. Sometimes if you see the same patient in the stage where it is more advanced, where it is no longer the throat and the nose that is involved, it is more a lung, the congestion of the lungs. This is that stage where the disease has progressed into a much advanced stage. Arsenic, as the temperature rises, as he goes day by day without being treated, he is known to deteriorate. And what you see in deterioration is the extreme prostration of arsenic. This we all know, that he just slides in bed, sinks basically. Absolutely no energy to get up. But the thirst still predominates. This is very peculiarity of arsenic. Then, in this stage, how to understand arsenic is again the night aggravations. The night aggravations and the heat stage with the thirst and the extreme prostration, which has deteriorated over a period of time, is one which actually confirms arsenic. This is what I have verified in my practice, and this is what even Dorothy Shefford writes in her approach to viral fevers. If you get the anxiety, if you get the fastidiousness, it's fantastic. And generally, you will always find that in arsenic. And without the anxiety, without the thirst for sips of cold water, and without the patient complaining of burning and not feeling better by warmth, you can't prescribe arsenic. This is something that is very important to prescribe arsenic. So I don't think we'll miss arsenic if we can see arsenic in all these three stages the way I described arsenic. This is clinical, something that we have verified in our practice again and again and again when you're treating viral fevers, especially arsenic. I would love to read your feedback and your questions. Thank you very much. This is Gajanan Dhanipkar saying bye to you. Bye.